Hello everybody and welcome back to Coverage Confessions. Today we're tackling a topic that actually causes a lot of confusion. Medicare versus Medicaid. They sound similar, but in reality, they're quite different. So stick with me today because I will explain the nuances of each program. Also, we're going to talk about who qualifies, the costs involved, and how you can use each to your maximum benefit. You ready? Let's jump right in. So my name is Mari Martinez. I am the founder of North Star Insurance, and today's confession comes from a lady named Linda. Thank you for writing us, Linda. And she said, I am honestly perplexed. My neighbor and I both have Medicare, but she doesn't pay the $185 per month that is deducted from our Social Security check. Also, she doesn't have any out-of-pocket costs when she sees specialists. Yet, I keep seeing deductions and additional fees. What am I missing? So, Ms. Linda, this is actually a really good question. You've stumbled upon what's called dual eligibility, and this is a scenario that many people don't fully understand, but don't you worry. We're going to dive deep into exactly why this happens and how it works. First things first, let's thoroughly explore Medicare. So, Medicare is the federal health insurance program primarily designed for those aged 65 and older, as well as individuals under 65 with specific disabilities or chronic health conditions. It is divided into several key parts, each of them serving distinct roles. Starting with Medicare Part A, that covers your inpatient hospital stays, skilled nursing facility care, which is when they let you go out of the hospital but you're not fully well to be home on your own, hospice care, and certain home health care services. Typically, there's no monthly premium for Part A if you or your spouse paid Medicare taxes for at least 10 years or 40 quarters. However, it is important to remember that there's a deductible of $1,676 per hospitalization stay, which is in 2025. That's for this year. This deductible resets after you've been out of the hospital or the skilled nursing facility for 60 consecutive days, potentially resulting in multiple deductibles within 1 year if hospitalization is actually frequent. Number 2, Medicare Part B, which covers outpatient care such as doctor visits, specialist consultations, preventive screenings, diagnostic tests, medical equipment like wheelchairs, walkers, oxygen equipment, and also ambulance services. In 2025, the standard Part B premium is $185 per month, although higher income individuals may actually pay more. You will also have an annual deductible set at $257 this year. After paying this deductible, you're generally responsible for 20% of Medicare covered services without a cap. So this means that significant medical needs can quickly accumulate very large expenses. Number 3, Medicare Part C, or also known as Medicare Advantage plans, are offered by private insurance companies approved by Medicare though, so they have to have that contract. Medicare Advantage plans combine the coverage of Parts A and B and typically include prescription drug coverage, also known as Part D, and often offer additional benefits not covered by original Medicare like dental, vision, hearing, wellness programs, some even transportation, and over-the-counter medication allowances, etc. One critical thing to remember is that these plans usually operate within specific provider networks, meaning it's important to confirm that your preferred doctors and specialists actually participate in your chosen plan. Also, Medicare Advantage plans very often have lower or zero monthly premiums compared to a Medigap policy, for example, but they involved some co-payments, co-insurance for various services as you actually use the plan benefits. Medicare Part D, or prescription drug coverage, specifically is designed to help cover the cost of medications, prescription medications. These plans, also offered by private insurers, have varying formularies, which is really the name for the list of covered medications in the plan. And also these plans vary in cost structures. Each year, it's critical to carefully review your Part D plan during the Medicare annual enrollment period to ensure that your medications are still covered affordably and that these formularies haven't changed or what those changes could be. Please note that despite its broad coverage, Medicare alone doesn't cover everything. Key gaps include long-term care, for example, routine dental care, eye exams, glasses, hearing aids, and most alternative or holistic treatments. To fill these substantial gaps, you might consider supplemental coverage options like Medigap, also known as Medicare Supplement Insurance, or Medicare Advantage, which we talked briefly about and will actually discuss more thoroughly later in this episode. Now, let's take an even deeper dive into Medicaid. Medicaid is fundamentally different from Medicare. It is primarily designed for individuals and families with lower income and limited resources. Unlike Medicare, which is federally run, Medicaid is jointly funded and administered by federal and state governments, meaning eligibility and coverage details can vary state by state. Let's talk about eligibility first. To qualify for Medicaid, your income and assets must meet specific state guidelines. So, for instance, here in Texas, an individual generally qualifies for Medicaid if their monthly income falls below about $1,153, while a married couple's combined monthly income threshold is roughly $1,546. These income limits can adjust annually and are slightly different depending on specific state rules and programs. But it's not just about income. The states also actually look at your assets, such as savings accounts, retirement funds, and other property. Typically, essential items like your primary residence and one vehicle are exempt, but additional assets can affect your eligibility into Medicaid. Understanding these nuances can be complex, which is why I really think that consulting a professional is extremely beneficial. When it comes to benefits, Medicaid offers extensive coverage to ensure that low-income individuals have access to comprehensive healthcare services. Medicaid covers inpatient hospital care, outpatient medical services, routine doctor visits, emergency care, and preventive health services. It can also cover essential services not typically included in original Medicare, such as comprehensive dental, vision care, hearing aids, mental health treatment, for example, and even maternity care. Different topic, but still important. An important benefit that many people don't know about is Medicaid's coverage for non-emergency medical transportation. This ensures that Medicaid recipients have reliable transportation to medical appointments, and this makes healthcare more accessible for those without regular access to transportation. Now let's revisit Linda's situation. Her neighbor likely qualifies as dual eligible. Dual eligibility means qualifying for both Medicare and Medicaid simultaneously. For these individuals, Medicaid acts as a financial safety net by paying Medicare premiums, deductibles, copays, and coinsurance. This explains why her neighbor incurs little or no out-of-pocket expenses. Applying for Medicaid can seem intimidating because of documentation required, which typically includes proof of identity, residency, citizenship status, income, and assets. However, don't let this discourage you. Professionals and healthcare navigators, including our team at North Star Insurance, are always available to help guide you through the application process step by step, ensuring that you clearly understand each requirement and maximize your chances for approval. So even if Medicaid is not an option for you, understanding the gaps in original Medicare is crucial for your healthcare planning. So let's break these down in greater detail to really understand why supplemental coverage is so essential. One of the most significant risks of relying solely on original Medicare is the lack of an annual spending cap. Without this limit, your healthcare costs can skyrocket during serious illnesses or prolonged treatments, potentially leading to significant financial hardship. Medicare Part A charges that $1,676 deductible that we talked about for each hospital admission. This deductible resets every time you're out of the hospital for 60 consecutive days. So frequent hospitalizations or treatment requiring multiple admissions can become extremely costly very quickly. Also, after meeting your Part B annual deductible of $257, you're still responsible for paying 20% of all approved outpatient medical expenses. And these costs have no annual limit, meaning the potential financial exposure is considerable, especially if you require ongoing care such as chemotherapy, dialysis, or just regular specialist visits. Many essential routine healthcare services like dental cleanings, eye exams, glasses, hearing tests, and hearing aids aren't covered by original Medicare, like we said. So these exclusions often surprise beneficiaries and can lead to significant out-of-pocket expenses, negatively impacting your quality of life and your budget. To protect against these extensive financial risks, there are two supplemental options: Medigap, or Medicare Supplement Plans. These policies specifically address the gaps in original Medicare by covering costs such as deductibles, coinsurance, and copays. They also are standardized, meaning each type provides predictable level of coverage. And they also offer nationwide provider access without network restrictions, making them particularly attractive for beneficiaries who travel often or prefer unrestricted provider choices. Second, Medicare Advantage plans, also known as Part C that we talked about. They are very comprehensive plans provided by private insurance companies, and these plans bundle Medicare Part A and B, very often include prescription drug coverage, and add extra benefits like routine dental, vision, hearing, wellness programs, and like we said, sometimes transportation and over-the-counter medication allowances. Crucially, Medicare Advantage plans come with an annual maximum out-of-pocket limit, capping your yearly expenses and significantly reducing the financial risk. When deciding between Medigap and Medicare Advantage plans, consider several factors very carefully, actually. Healthcare needs, so if you require frequent specialized care, a Medigap policy might offer more predictable expenses. Budget considerations, Medicare Advantage generally offers lower monthly premiums and includes copays and network limitations, while Medigap often has higher monthly premiums but minimal to no out-of-pocket expenses. Provider flexibility. If maintaining your current doctors and specialists is a priority, ensure that you carefully review the provider networks of Medicare Advantage plans or consider Medigap for much broader access. Also, lifestyle factors. You've got to consider your lifestyle, such as frequent travel or specific health concerns that you might have, to determine which supplemental coverage best aligns with your specific needs. Taking the time to thoroughly review these considerations annually during the Medicare annual enrollment period, which runs from October 15 through December 7th ensures that you consistently have the coverage that fits your evolving healthcare needs. And there you have it, Medicare versus Medicaid clearly explained. I really hope that this episode cleared up confusion and empowered you with knowledge to confidently navigate your healthcare options. Please remember that making the right choice is crucial for your health and financial peace of mind. Also, if you have a Medicare or healthcare confession or just a question that you'd like featured on a future episode, please comment below or reach out to me directly. If you liked this video, if you didn't think that it sucked, please like, subscribe, and share it. Or just one of the three, I'm happy with that. Thank you for joining me today on Coverage Confessions. And until next time, please take care and may your next Medicare decision be one that you're actually proud of.